So good evening everyone. I hope I'm audible and visible. Kindly confirm it once so that we can start this session. So welcome to this session. It's a one short revision session today, and the topic here that we are going to discuss today would be about the clinical presentation, the diagnosis and the management of a very important disease which is called as syphilis. So this topic, let it be for any exams for NEET PG, INICET or FMGE. It's a very important topic, and mostly syphilis is asked as a part of genital ulcer disease, right? And here, since this is a very vast topic, we would like to spend some time to understand how the clinical presentation is and what are the investigations that you can do so that you can diagnose this disease, and ultimately about the management as well. So without further delay, let's begin this session now. So to start with, let's give a very short introduction about what happens in this disease called syphilis. Now this disease is caused by this organism which is called as Treponema pallidum, right? This is something that all of you would be knowing, which is it is considered to be a motile spirochete, and that is why we would be able to see something like a corkscrew motility. So you'll be able to see something like a corkscrew motility in this disease as well. And as you know that this disease is going to be a sexually transmitted infection. So the transmission, it can be either sexual, and it can also be transmitted from the mother to a child. That is why there is a vertical transmission as well. And in some cases, it can also be transmitted via blood transfusion as well. The basic incubation period, I would say it's around, you can remember it as 9 to 90 days. So this is something that is easy to remember. Around 9 to 90 days is going to be the incubation period of Treponema pallidum. And this disease has been called as a great imitator because why? It can present to you in various forms, in different presentations, and it can, most of the times it can guide you to some wrong diagnosis as well. That is why this disease is called as a great imitator, and it progresses through 4 of the clinical stages. Now anyone who is attending this lecture, can you just tell me what are the clinical stages of syphilis? Like what are the stages through which this disease can go through? Anyone? Just let me know in the chat box. Syphilis, how does syphilis present? What are these 4 stages that I am mentioning here about? So please remember, it always go through a primary stage, a secondary stage, a latent stage, and finally we will be having a tertiary stage as well. So let's see one by one. So what are the stages here? So primary, secondary, latent and tertiary. Very good, Stardust. So your answer is correct. Primary, secondary, latent, and of course there's a tertiary stage as well. This tertiary is considered to be a stage of complications. At the same time, there is something called as congenital syphilis, which can be transmitted from the mother to a child. Now let's see in detail what happens in each of these stages. Now always remember what happens in a primary syphilis. Primary syphilis is what we call as a chancre, where the patient will develop a genital ulcer most of the times. Genital ulcer most of the times. So in this genital ulcer, please remember, syphilis S for S. And what is S for S? Syphilis is a silent disease. It's considered to be a silent disease. Isilye, for this reason, we have a painless genital ulcer here. So this is going to be a painless ulcer as well as a painless lymphadenopathy. So please remember, here the combination here is, remember it as a silent disease. Isilye we get a painless ulcer as well as a painless lymphadenopathy. So both are going to be painless in the cases of syphilis. So this is one very important thing that you have to note. And don't make it complicated here. Only one additional point on an MCQ perspective which you may remember is, in case they ask you, chalo, genital ulcer is the most common presentation. But if they ask you what is the most common extragenital site where you can get a chancre, then what should be your answer? your answer here should be the extragenital. The most common site is going to be the lips. Okay, it can be, sometimes the option can be oral mucosa, yeah, it can be lips. So please go for lips as the right choice here. Now, after primary syphilis, what happens is, just imagine that a patient has got a primary syphilis. He probably would be having a positive history, isn't it? He may be having a history of a unprotected intercourse with a sex worker or anything as such. And finally, once the patient is developing a painless ulcer as well as a painless lymphadenopathy, the patient would be reluctant to come to you for a consultation. And most of the times what happens, the patient will automatically progress into a secondary syphilis. Now let's see what happens in secondary syphilis. जहाँ पे inguinal lymphadenopathy था, वहाँ पे the patient is going to develop a generalized lymphadenopathy. Generalized lymphadenopathy now. So inguinal lymphadenopathy becomes a generalized lymphadenopathy. Along with generalized lymphadenopathy, he is going to develop different types of rashes. And in this different types of rashes, remember, it can be a macular rash, papular rash, जैसे वो exanthematous rashes होता है, वो भी हो सकता है, या फिर papulosquamous rashes भी हो सकता है. But please remember for your MCQs, the patient will not show vesiculobullous lesions. The patient will not show vesiculobullous lesions. Like यहाँ पे जो all rashes बताया था, so this all rashes can be maculopapular or it can be papulosquamous. Papulosquamous rash. Papulosquamous मतलब papules हो सकता है या फिर plaque lesions भी हो सकता है. Maculopapular is again like an exanthematous rash. But in all these cases of syphilis, you cannot expect to see a vesiculobullous lesion. So that is what you have to keep it in your mind. Along with that, there are many other cutaneous lesions that you can expect. एक हो गया alopecia. किस टाइप का alopecia हो सकता है? In syphilis you can see a moth-eaten alopecia. In moth-eaten alopecia, it's a kind of a patchy hair loss. It's a kind of a पैची हेयर लॉस. जैसे एलोपेशिया एरियाटा में दिखते हैं, वैसा ही यहाँ पे पैची हेयर लॉस हो सकता है, वेयर इट कैन बी अ मल्टीपल पैची हेयर लॉस. इट्स कंपेयर टू अ मोथ ईटन एलोपेशिया. अलॉन्ग विद दैट वी कैन सी सो मेनी अदर लीशंस. In the oral mucosa, you can see mucus patch, snail track ulcers, and mostly in the genital region, you can find condyloma lata. Now, what is the difference between a condyloma lata and a condyloma acuminata? Anyone? Can you please let me know in the chat box? Condyloma acuminata और condyloma lata में फ़र्क क्या है? What is the difference? Because I'm sure that most of you must have heard about condyloma acuminata. Now let's see what is the basic difference. So please remember that condyloma acuminata, this is seen in HPV infection. And what does HPV infection bring? So HPV infections can lead to warts. So whenever you can see genital warts, it is called as condyloma acuminata. Whereas whenever you can see condyloma lata मतलब यहाँ पे flat topped lesions होता है. यहाँ पे जो flat topped lesions. So these flat topped lesions that you can see, it's called as condyloma lata. It's a highly infectious lesion which you can see in secondary syphilis. Along with that, I have already told you that generalized lymphadenopathy भी हो सकता है, and some systemic symptoms like fever and all can also be seen. Now I hope you are able to follow. In primary syphilis, genital ulcer. Secondary syphilis, यहाँ पे कोई genital ulcer नहीं होता. Most of the times काफ़ी सारे स्किन मैनिफेस्टेशंस हो सकता है या फिर म्यूकोजल मैनिफेस्टेशंस हो सकता है, लाइक म्यूकस पैच, स्नेल ट्रैक अल्सर्स और अ condyloma lata. Now let's see what happens in latent syphilis. Anyone who knows what is the meaning of this thing, latent syphilis? Can you just let me know in the chat box ki what exactly is a latent syphilis? In latent syphilis, it's okay if you make a mistake, you can just give it a try कि latent syphilis क्या होता है. In latent syphilis, please understand, यहाँ पे the patient will have no symptoms. So there is no symptoms here. Then what is the only thing that is present in a latent syphilis is you can find circulating antibodies in the blood. So whenever a patient of syphilis does not have any symptom and they only present to you, I mean when you try to see the blood investigations, if you are able to see circulating antibodies in the blood, this phase of syphilis is called as a latent syphilis. So in latent syphilis, there are two types of latent syphilis. The first type is early latent and the second type is called late latent. यहाँ पे सिर्फ एक ही डिफरेंस है कि in early latent, which usually happens within 1 year of an infection, यहाँ पे the patient is infectious. Whereas in late latent, यहाँ पे the patient is going to become non-infectious. That is the difference. So please remember, latent syphilis मतलब there is no symptom. Okay, there is no genital ulcer, there is no skin rash, there is no lymphadenopathy. Sirf antibodies in the blood. That is going to be latent syphilis. And there are two types of latent syphilis, which is early and late latent. Early latent में patient infectious हो सकता है और late latent में patient is not infectious. And except for the only exception यहाँ पे जो है, that is congenital syphilis, which we'll talk in some time. And moving further, what happens in tertiary syphilis? Tertiary syphilis, please remember, this is going to be the stage of complications. This is going to be the stage of complications. Now, what are the complications here? Please remember, in this way, it affects two of the organ system or dono organ system. It starts with the letter C. Which are the organ system that is involved where you can find some complications in syphilis? The organ systems are CVS, right, or CNS. जैसे cardiovascular system हो गया and central nervous system हो गया. So these are the two organ systems where a patient can present to you with complications. And in tertiary syphilis, there is some skin manifestation as well. So the skin manifestation is what you call it as a gamma. Syphilitic gamma या फिर gummatous lesions. This is always seen in tertiary syphilis, right? And in cardiovascular manifestations, what you can see is the patient usually may get some aortitis, some aneurysm can happen, aortic regurgitation can also be seen. All those things are seen as a cardiovascular complication. Now, what about central nervous system? जब central nervous system involved होता है, then what are the different types of presentation? One is stapes dorsalis or general paresis. And in the eyes, you can also find Argyll-Robertson pupil. Now, what is this Argyll-Robertson pupil? It's also called as the prostitute pupil, right? Because this can accommodate but does not react. So, this type of a pupil in the eyes, it can accommodate. Accommodation reaction होता है, but it will not react to the light. इसीलिए we call it as a Argyll-Robertson pupil, and because of this property, we also call this type of a pupil as prostitute's pupil. So that is about it. So if there is any confusion, you can just let me know in the chat box. Otherwise I'll just keep moving. Okay? And now let's see what happens in congenital syphilis. Let us imagine that there was a patient who was positive for syphilis and the patient was not treated on time. If she is going to conceive, then while she conceives, there is a chance that she can pass on this infection from her to the baby. This is called as a congenital syphilis. So this congenital syphilis, it usually happens because of a transplacental transmission. यहाँ पे we again have two classification. What are the two types of classification? One is early and the other one is late. Whenever a child will present to you within 2 years of age, then we call it as a early congenital syphilis. Whereas if a child presents to you after 2 years, we call it as a late congenital syphilis. So यहाँ पे you all should be knowing that the presentation of a early congenital syphilis is called snuffles. Now what do you mean by snuffles? Snuffles means there is a excessive mucus secretion. Snuffles means there is going to be a excessive mucus secretion. Like a child who comes to you, there's a lot of secretion that is happening from the nose. Like when there is excessive mucus secretion, you can call it as a snuffles. Along with that, there would be different types of rashes. Now comes a very important differentiating feature. ये जो rashes है, which you can see in the case of a congenital syphilis, they are usually vesiculobullous rash, and this is going to be a very important point for your exam. रीज़न क्या है? कैन यू प्लीज़ ट्राई टू रिकलेक्ट कि हमारा जो डिस्कशन में मैंने बोला था कि प्राइमरी सिफिलिस में क्या होता है, इट इज़ यूजुअली अ जेनाइटल अल्सर और कोई स्किन रैशेस नहीं है. सेकेंडरी सिफिलिस में क्या होता है, स्किन रैशेस होता है. किस टाइप की रैशेस? मैक्युलोपैपुलर रैशेस हो सकता है या फिर पैपुलोस्क्वामस रैशेस भी हो सकता है. बट व्हाट इज़ नॉट सीन इन सेकेंडरी सिफिलिस, what is not seen is a vesiculobullous rash. But when it comes to a congenital syphilis, what is a type of rash that you can expect in a baby? You can expect a vesiculobullous rash in a early congenital syphilis. So this can be a very important differentiating feature. And then comes a late congenital syphilis after 2 years. After 2 years, you can remember it as SIN. So what is SIN? S stands for sensory neural hearing loss. So there is no hearing here. So there is a hearing loss. I stands for interstitial keratitis. Interstitial keratitis. And N stands for notching of central incisor teeth. Notching of central incisor teeth. So these are the differences, where these are the three things that comprises of a Hutchinson triad, which can be seen in late congenital syphilis. Okay, late congenital syphilis. So Hutchinson teeth can also be seen. So what is Hutchinson teeth? That there is a notching. Like let's say that this is a teeth. So in this teeth would be having some notching that can be seen. So this notching is typically seen in late congenital syphilis. Is that clear? Chalo. So that is all about different types of syphilis. Now we have discussed about primary, secondary, latent and tertiary. And along with that, we also discussed about congenital syphilis as well. So now we know about 5 types of syphilis. Now let's try to understand how do you diagnose these type of syphilis stage by stage. Now coming to the diagnosis, there are different investigation which can be done. First जो investigation है, that is going to be called as a dark field microscopy. So when do you do a dark field microscopy? Anyone? Can you just let me know in the chat box कि when are you going to do a dark field microscopy for the diagnosis of syphilis? I'm just giving you few seconds to answer in the chat box. When do you do a dark field microscopy for a diagnosis of syphilis? Options can be primary syphilis, secondary syphilis, tertiary syphilis, latent syphilis, congenital syphilis. So please remember, dark field microscopy जो है, this is done in primary syphilis as well as in secondary syphilis, but not in all the type of secondary syphilis. I'll come to that in some time. And the second option is that some of the investigation that we can do is to check the antibodies in blood. To check the antibodies in blood. So जो antibodies in blood, this is what we call it as serological test. Now what are the types of serological tests that we can do? It can be either a non-tryponymal test or it can be a tryponymal test. In non-tryponymal, we get the usual screening test, जैसे VDRL हो गया, RPR हो गया, and then the specific वाला test. So the specific investigation that we have in syphilis should be the ट्रिपोनिमल टेस्ट, जहाँ पे हम TPHA करते हैं, या फिर FTA ABS also can be done. Now let's see what happens stage by stage. Okay, so when do we do a dark field microscopy? Dark field microscopy is done when you are going to diagnose primary syphilis या secondary syphilis. In primary syphilis, our sample is going to be the chancre. मतलब जो genital ulcer होता है, from the genital ulcer we are going to take a specimen for the diagnosis of primary syphilis. In secondary syphilis, we don't do this dark field microscopy from the maculopapular rash, या फिर we don't do this from any of the papillosquamous rashes. We do it from condyloma lata, which is going to be the genital lesions that you can see. Okay, so primary syphilis mein we do it from the genital area, from the genital ulcer. Secondary syphilis also we do it from the genital area, from those moist flat top lesions, which is called as condyloma lata. And when you do this dark field microscopy, what is a result that you can see? You can mostly see a corkscrew motility. You can mostly see a corkscrew motility. So that is about dark field microscopy. So now let's see, when do we check for antibodies in the blood? आपको पता ही होगा, प्राइमरी सिफिलिस में आर वी एक्सपेक्टिंग एनी एंटीबॉडीज इन द ब्लड? बिल्कुल नहीं, राइट? सो प्राइमरी सिफिलिस नो एंटीबॉडीज, यहाँ पे देयर इज नो एंटीबॉडीज इन द ब्लड in primary syphilis. So this is going to be an important thing. But when do you find antibodies in the blood? We mostly find them in secondary syphilis. So in secondary syphilis, what are the things that we can do? One is a non-triponimal test, and the second one is going to be a triponimal test. So let's first talk about what are the triponimal tests that we can do. So the triponimal test that we can do are, one is non-triponimal test that we are doing. One is a VDRL, second one is RPR, and the third one is TRUST. Mostly ये जो investigations है, this is done either to screen the population for syphilis or to monitor the disease. Okay, VDRL, RPR or TRUST, all these things are done for screening and monitoring. पर अगर आपको कंफर्म करना है कि दिस पेशेंट इज हैविंग 100% इट इज गोइंग टू बी सिफिलिस, देन यू विल हैव टू गो फॉर अ ट्रिपोनिमल टेस्ट. इट्स अ confirmatory test. What are the confirmatory tests that we have? These are the FTA ABS, TPHA, and less likely to be done is TPI. It is not done very commonly, so you can at least remember two. FTA ABS हो गया, or the second one is TPHA. The second one is TPHA. So these are the tests that we can do, and based on these tests we can definitely diagnose syphilis. Now here one important point that you should know is, screening test, it can become positive when the patient is having an active disease, right? Whereas these confirmatory tests that we do, जैसे FTA ABS, TPHA, once a patient is having this positive, this is going to remain positive for life. It's a very very important thing. जैसे अगर patient को syphilis था in the past, still when you do a FTA ABS or TPHA, even if the patient has taken a treatment of syphilis, still this patient is going to remain positive for life. So that is an important point regarding the triponimal test like FTA ABS and TPHA. So generally talking about, once you have diagnosed the patient, जैसे आपने डार्क फील्ड माइक्रोस्कोपी किया होगा, या फिर आपने जो एंटीबॉडीज इन द ब्लड जो होते हैं, सो यू हैव डन सम स्क्रीनिंग टेस्ट या फिर कंफर्मेटरी टेस्ट. अभी जब आपका डायग्नोसिस कंफर्म हो गया, देन वी गो इनटू ट्रीटमेंट. सो व्हाट इज़ द ड्रग ऑफ चॉइस? द ड्रग ऑफ चॉइस in the cases of syphilis is going to be this drug which is called as benzathine penicillin, which is available as an injection, right? So whenever the patient is having a penicillin allergy, उस time पे you can even think about doxycycline या azithromycin. Now In cases of pregnancy, the only option that we have is to desensitize and still treat the same patient with penicillin, at least theoretically, right? And we'll have to follow up the patient with VDRL titers after a certain month intervals. So remember, the drug of choice is benzathine penicillin. But are there cases in syphilis जहाँ पे हम benzathine penicillin use नहीं कर सकते, या फिर benzathine penicillin may not be that effective in the cases of syphilis? Anyone? Which are the cases in syphilis जहाँ पे benzathine penicillin may not show a good result or may not be effective enough? Any idea? So let's see what are the cases where benzathine penicillin cannot be used as well. These can be in the cases of neurosyphilis, like whenever there is an involvement of the brain, or in the cases of congenital syphilis. So let's remember, generally speaking, the drug of choice is benzathine penicillin, but the exceptions are we have to go for aqueous crystalline penicillin in the cases of neurosyphilis or in the cases of congenital syphilis. Okay, the reason is benzathine penicillin, it cannot cross the BBB blood brain barrier, isn't it? So if you have to cross it, then you'll have to go for a crystalline aqueous penicillin or aqueous crystalline penicillin, whatever you call it as, in two cases, that is in neurosyphilis and in congenital syphilis. Is that clear? And in congenital syphilis. So that is about the treatment and stage wise treatment. So to have a very quick summary, so we know that syphilis can be divided into primary. So it can be divided into primary, secondary, latent or tertiary. So these are the various stages. Primary syphilis mein, we know that the patient will present to you with a genital ulcer disease, which is usually called as a chancre. Whenever there is a chancre, you will just do a dark field microscopy from the site of the ulcer, and once it is positive, we treat the patient with benzathine penicillin. Whereas in secondary syphilis, यहाँ पे patient को कोई genital ulcer नहीं होगा in most of the cases. In such cases, what you can see is you can see a rash in the body, in the skin. So that is why the patient will usually end up in the dermatology OPD. Along with that, when you see the genitals, यहाँ पे कोई genital ulcer नहीं है, but you can find condyloma lata. Condyloma lata. Now here there is no point of doing a dark field microscopy in most of the cases. आप कर सकते हो over the condyloma lata. Otherwise, our investigation of choice in secondary syphilis can be VDRL, TPHA or FTA-ABS. FTA-ABS, which is going to be serological investigation. In this case also, you can go for a single dose of benzathine penicillin. Benzathine penicillin. Now talking about latent syphilis. Latent syphilis में patient को कोई symptoms नहीं होगा, सिर्फ antibodies in the blood होगा, इसीलिए asymptomatic है, and there is antibodies in the blood. But again, you have to go for treatment. Treatment आप same treatment दे सकते हो, that is going to be benzathine penicillin. Whereas in tertiary syphilis, where a patient may have some CNS manifestations or CVS manifestations, here you can again go for a serological investigation and treat the patient. But please remember, if the patient is having central nervous system involvement, you'll have to go for a aqueous crystalline penicillin, or in other cases you can go for a benzathine penicillin treatment itself. So this is basically what we have discussed in today's lecture. So now let's see some of the MCQs as well, like the kind of MCQs that you can expect for any of the exams. Let's see this question. A 26-year-old patient presents with a single painless ulcer on the glans penis that appeared 3 weeks after an unprotected intercourse. The ulcer has a clean base and a firm indurated edges. Inguinal lymph nodes are firm and non-tender. So in what is the likely diagnosis and what is the causative organism? What is the answer here? So as I told you, syphilis is a silent disease जहाँ पे painless ulcer होता है and painless lymphadenopathy भी होता है. So the question says there is a painless ulcer and there is a non-tender lymphadenopathy. So the options are chancroid, herpes genitalis, syphilis and donovenosis. What is the right answer? Here this one should be syphilis, right? So now let's see the second question. A woman presents with a painless ulcer on the lips following a oral sexual contact. What is the most common site for an extragenital chancre? So we always look for the chancre in the genitalia. But if a chancre should happen in a site other than the genitalia, what is the most common site? Is it the fingers? Is it the tongue? Or the lips? Or the tonsils? What's the right answer here? Anyone in the chat box? What would be the right answer here? Here, yes, the most common site of a extragenital chancre is going to be the lips. It is going to be the lips of the patient. So now let's see another question. A patient presents with generalized non-itchy rash. Generalized non-itchy rash involving the trunk, the palms and the soles along with a patchy hair loss and moist papules around the anus. Which of the following is not a feature of this stage? So which stage are we talking about? यहाँ पे generalized rashes is there, which means you can find a lot of skin lesions are present. And the patient is having some lesions over the palms and soles. Palms and soles में pigmented lesions होते हैं. And there is a patchy hair loss. What is this patchy hair loss called? This is called as moth-eaten alopecia. And there are some moist papules around the anus. So what are these moist papules around the anus called? It is called as condyloma lata. So what is not a feature of this lesion, of this stage? Snail track ulcers हो सकता है? हाँ हो सकता है. Condyloma lata, it's already mentioned in this MCQ. Vesiculobullous rash and moth-eaten alopecia. So what is the odd one out? Vesiculobullous rash, because all rashes can be seen in secondary syphilis except vesiculobullous. So except vesiculobullous, all the types of the rash can be seen here. That is why this would be the odd one out. So now let's see one more question here. A patient previously treated for secondary syphilis has a reactive VDRL. So यहाँ पे reactive VDRL means it is going to be serologically positive, but no symptoms, and he is not sexually active for the last 2 years, which means that this can be something which is present for more than 2 years, है ना? VDRL may be positive for more than 2 years now. So, but there is no symptoms as well. Is he in the early latent stage or late latent stage? Anyone? What is the answer? Early या late latent, tertiary या relapse of secondary. अगर secondary का relapse होता, then the patient would definitely have symptoms. पर यहाँ पे तो symptoms नहीं है. So I can easily rule out relapse of secondary. What about tertiary? क्या tertiary हो सकता है क्या? Tertiary में क्या होगा? गम्मा हो सकता है skin में, और कार्डियोवास्कुलर इन्वॉल्वमेंट होना चाहिए या फिर सेंट्रल नर्वस सिस्टम का इन्वॉल्वमेंट होना चाहिए. तो यहाँ पे ऑल दीज थिंग्स आर ऑल्सो नॉट मैंशनड. सो इट इज़ मोस्टली अबाउट वेन एवर देर इज़ नो सिम्टम, इट इज़ मोस्टली अबाउट लेटेंट काइंड ऑफ सिफिलिस. अगर द सिम्टम्स आर प्रेजेंट विद इन 1 ईयर, अर्ली लेटेंट हो गया. इफ इट इज़ प्रेजेंट आफ्टर 1 ईयर, लेट लेटेंट हो गया. But यहाँ पे there is also mentioned that the patient is not sexually active for 2 years. So the best answer here should be a late latent syphilis. Late latent syphilis. So now let's see another MCQ. A 50-year-old man presents with ataxia, lightning pains and a pupillary abnormality. The pupils, they constrict on accommodation but not too light. So what is the name of this kind of a pupil? We have already discussed about it during our lecture. So this type of pupil is called as Argyll-Robertson pupil. Why is this called as a prostitute's pupil? Because it accommodates but it does not react, isn't it? So that is seen in neurosyphilis. And this one, dark field microscopy. This is done in secondary syphilis from which of the stages? So in which stage do you do a dark field microscopy? So yes, dark field microscopy is done from the specimen itself. So from which specimen? Is it taken from the blood? No. Oral mucosa? No. Condyloma lata या cerebrospinal fluid? So here, remember, in secondary syphilis, dark field microscopy can be done from condyloma lata, which is going to be a very infectious lesion. But most of the times, dark field microscopy is done in primary syphilis, right? In primary syphilis, right from the chancre itself, or the genital ulcer itself. And which test remains positive lifelong even after a successful treatment? Anyone who can answer this? Is VDRL going to be positive for lifelong? RPR going to be positive for lifelong? TPHA or trust? So remember, non-treponemal test, they are mostly used for screening. And monitoring, and they usually do not stay positive throughout, isn't it? What stays positive throughout should be the treponemal test. So the treponemal test, they are going to be positive throughout the disease. Even after the patient is treated, still you will be able to find that this treponemal test is going to be positive. Among all these things, which is a treponemal test? Yes, it is going to be the TPHA. TPHA is going to be the positive thing. That is about lifelong positivity even after successful treatment. So that is all about this discussion regarding syphilis. I hope it has been helpful for you. So since this topic syphilis, it is usually asked among the genital ulcer disease. Please remember, it's a silent disease, it's a great imitator, and it goes through various different phases. And in all these phases, the investigation is going to be different, because you'll have to go for a dark field microscopy in primary, you'll have to go for serology in the secondary, and all those things. And in the cases of treatment, the general drug of choice is going to be benzathine penicillin, except in the cases of congenital syphilis and in the cases of neurosyphilis, where you are going to use a aqueous crystalline penicillin for the management. So that is all about most of the important points that you should remember when it comes to syphilis, and I hope that this is going to help you for your exams as well. We'll be coming up with more such topics in the future, and thank you so much for being a good listener, and wishing you all the very best for the upcoming exams.